Hello all, welcome to CARE Samvaad with me, Mirchi Hemant, and today I have Dr. C Gupta with me. Sir, welcome to the show.
Hi Hemant, good to be here.
Very, very excited. Also because we have like a list of questions that we got from this crowd through social media. So I'm going to shoot all of them towards you.
Well, I hope I'm able to do justice to them.
I'm sure you can, Doctor. Doctor, I mean, now that we've started, people keep saying that vascular surgeries are supposed to be extremely critical, very, very, sensitive in nature. Can you please walk us through that? What is this vascular study in totality?
Yeah. So Hemant, if I talk about vascular surgery, it basically deals with all the arteries and veins and lymphatics. So these are all the tubes which carry blood away from the heart and then deoxygenated blood back to the heart. And we operate on these arteries. So obviously it is very, very intricate. Now, what makes vascular surgery, or rather a vascular surgeon, very special is that he does not only open surgery on these, but he also does what we call endovascular procedures like angioplasties, right, what you've heard cardiologists do.
Correct.
We are also vascular physicians. So in fact, more than half the patients that we see in the clinic, we treat them only with medicines and lifestyle advice.
Oh, absolutely. Lifestyle is the key word, doctor. And also now that we are talking about vascular surgeries, doctor, please tell me, with the help of the medical technological advancements, how do you think the vascular surgeries evolved over the years?
Yeah. So vascular surgery is actually one of the younger surgical specialties. It really took wings in the last century. Unfortunately, it was war. But a lot of surgical things do develop during the war because there is an opportunity. And vascular injuries are very common during war. So it was the Korean War and the Vietnam War during which a lot of vascular techniques actually became very, very refined. But what has happened lately is from open surgery, we are doing a lot more of what we call endovascular or minimally invasive procedures.
Right.
So there is technological advancement in the terms of the cath labs that we use, the imaging that we use, very good CT angios and MR angios. Ultrasounds are like routine. It's like a cardiologist uses a stethoscope. I use an ultrasound in the clinic. So that way technology has made a really huge difference to how we practice vascular surgery.
And also in continuation with that, doctor, these days on TVs or on newspaper, we see ads with regards to varicose veins. They have all sorts of things, all sorts of packages.
Yeah.
So I see random people talking about cool things about. Please walk us through the whole story of varicose veins. What is this?
Yeah.
And how does one fix it?
So this really is a story and I'll take some time.
Please.
So when I was training in the 90s, varicose veins were just one small part of what we used to treat. And in fact, the senior surgeons were not even interested in that. So as one of the junior guys, I would be operating all the varicose veins. In the late 90s, the treatment changed. One of the technological advances, the endovascular. So laser, radiofrequency ablation, and then laser glue, these made treatment much easier for varicose veins. They made it not only easy, they also made it very lucrative. So that is the reason you see so many advertisements. People actually spend lakhs on advertising their clinics and hospitals for varicose veins. And obviously they have to recover this money from the patient. Right. If I were to have, let's say, if I call it a guesstimate, based on the patients that I see every day who've been advised varicose vein surgery and who actually require varicose vein surgery, I would say about 80% of the surgeries or lasers or glue performed for patients in Hyderabad and perhaps across most major cities in India are not indicated.
Oh.
They are not required. And there are not many people who are actually willing to stick their neck out and say it. But I say it because we see this problem every day. Patients have normal legs and they're advised varicose vein surgery. So this is the problem. When something becomes easy, people tend to misuse the technology.
And at the same time, in continuation with the same doctor, if varicose veins are left untreated, are there some dangers that it will take us to?
Well, every medical illness has a potential for complications. Varicose veins is no exception. So we see so many people with varicose veins who've had them for 20 years, 30 years, and they're walking around. Because they see a TV ad, they rush to a hospital thinking they have something dangerous. Now, because these ads are scary, these ads say that you will develop a blood clot which will go to your heart, which will go to your lungs, and you will die in 48 hours. Now, a guy who's been living with varicose veins for 20 years or 10 years or 30 years, how can a doctor, even if I sort of choose to call him a doctor, because the way he practices, how can that doctor predict that his life is only 48 hours? It's wrong.
Correct.
Complications can develop, clots do form. Now, in the last over 30 years since I've been working in vascular surgery, I have seen 2 patients where clots formed in the varicose veins and actually travel to the lungs. And we see varicose veins every day. I have seen far more patients who have no varicose veins, whose veins have clots which have traveled to the lungs.
Oh.
So to get a surgery done because you're worried that clots will travel to the lungs is wrong. Of course, long-standing varicose veins, there can be color changes in the legs, ulcers can form, bleeding can happen, and when these happen, we do suggest that they should undergo surgery. But there are people who don't want a procedure. They have the option of using compression therapy or stockings, and they can actually keep their legs quite well with stockings.
And also, when you say the vascular department as such, doctor, deep vein thrombosis, the DVTs, can you please walk us through that? What's the whole story behind that?
Yeah, deep vein thrombosis compared to varicose veins is a totally different ballgame.
Right.
Now, it affects the veins, but we are now looking at the deep veins rather than the superficial veins which are affected in varicose veins.
Right.
So when we say DVT, typically we talk about the lower limb veins, but it could affect the upper limbs, could affect the veins in the veins in the brain, could affect the veins in the abdomen. But what happens is the blood gets clotted, and since blood does not flow, whatever organ is now obstructed tends to swell up and have pain. For if it's in the legs tend to swell up and become painful. It's a sudden onset generally. Now, there are many reasons why DVT can occur. Basically, our blood has a mechanism, and it's a beautiful mechanism created by nature. It doesn't clot. But if it falls outside, it clots. It doesn't clot in the veins. Because there is what we call a homeostasis, where a balance is maintained between the tendency to clot and the tendency not to clot. So if you have an injury, you press it for some time, the bleeding stops because there is some clotting mechanism that is a protective mechanism. Now, if the clotting mechanism overtakes or subdues the bleeding mechanism, clots form.
Okay.
So it's an imbalance. It happens quite often due to hereditary conditions where there are such products in the blood which tend to produce excessive clotting. And it can be precipitated by, let's say, a long surgery, especially cancer surgery, orthopedic surgery, hospitalization. Hospitalization increases the risk of DVT by 100 times.
Oh my God.
So if you are in the hospital, make sure your doctor takes precautions to prevent DVT.
But otherwise, how do one prevent them, doctor? Say one has, not surgery though, say someone has a sedentary lifestyle. So how does one fix or make sure that, DVT is not anywhere close to them?
So sedentary lifestyle leading to obesity is a risk factor for DVT. But somebody is just not very active, I don't think that increases the risk of DVT.
Right. And also as an extension to it, is the common word that we keep hearing, it's called the diabetic foot care. We feel really, scared when we listen to things like this, especially with the elders. What's the story about that, doctor?
So again, diabetic foot is a subject which is again very close to my heart, and we are really good at managing this problem. So we have a department of vascular surgeons, interventional radiologists, and foot surgeons who actually as a team take care of such patients. So what happens in diabetes, there is a reduced immunity and there is damage to the nerves. So when the nerves are damaged, the sensation in the foot tends to decrease or even completely go away. So there is a story one surgeon used to tell us that a diabetic man used to be walking on the wooden floor in his house, and whenever he was walking, there was a noise, tuck, 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 And he couldn't figure out what is happening. And one fine day when the foot really got swollen up, he discovered there was a nail stuck in his foot.
And he didn't even realize.
Because there is no sensation.
Ouch.
So diabetics can have two types of problems. One, when there is loss of sensation, there is excessive pressure, injury, they tend to develop ulcers on the sole. We call these trophic ulcers. Sometimes they happen because of excessive pressure. Sometimes they happen because of injury. Excessive pressure can be because of malfitting footwear, improper footwear, or it could be due to certain tendons or muscles overacting which need correction. The other situation is where the blood flow is also reduced. So now we have reduced blood flow, we have reduced sensation in a diabetic patient. That is a very, very potent combination which could lead to a major amputation. So we treat these patients on urgent basis with imaging, see the arteries where the blocks are. We want to restore the blood flow, we want to get rid of the infection, we want to correct any deformity which is putting excessive pressure, causing ulcers. So it's a fairly complex thing to do, and I think a multidisciplinary team is what manages diabetic feet in the best way, and this is a global phenomenon. I'm part of a couple of international groups, and we all talk about developing centers of excellence for management of diabetic foot and chronic limb ischemia. And I think multidisciplinary teams are the key to providing good care.
But I don't want to come to a hospital. I don't want to see a doctor. How do I prevent it? The precautions that I have to take.
Perfect. I think that is what each one should aim to do. Prevent a problem. As they say, a stitch in time saves 9. And it is really true. So if you're a diabetic, the first statement I would say, care for your feet as you would for your face.
Okay.
Your face should look good. Your feet should look even better.
Correct.
So which means no cracks, no barefoot walking, feet should be clean, use a good moisturizer except between the toes so that skin remains healthy. Look at your feet daily like you look at your face every day and care for it. If you can't see the sole, obviously you can't take a mirror, look at it, ask your spouse, your partner, your friend, somebody to look at it daily. You notice a change, you need to go to the hospital. Cut your nails carefully because it's very common for people to cut their nails very close to the skin, injure the skin, and their infection starts. Wear good prescribed footwear, what we call diabetic footwear. So typically what I tell my patients, if you're using diabetic footwear, don't use chappals.
Okay.
Because with chappals when you walk, and you can try it after we finish, with chappals or barefoot walking, we tend to put pressure on our toes. It's like there is no option. But if you wear sandals or shoes, you can just actually lift your foot. So there is no excessive pressure on the toes. So we prescribe what we call preventive footwear for people who have otherwise normal feet but are diabetic. So we prevent ulceration.
Like I said, doctor, now I really feel like, I felt like sitting in an AIMS and listening to this. So my next question would be about PAD. Everybody's talking about the peripheral artery disease. Please tell us, what is this? For a layman like me, please make me understand that.
Yeah. So we touched upon this when we spoke about diabetic foot where blood flow can be reduced. So when we say PAD or peripheral arterial occlusive disease, basically it's blood flow reduced to the legs. Typically we talk about the legs. It can happen in other areas and we will discuss some of those later. But when the blood flow to an organ is reduced, it hurts. So if there is a block in the artery which is supplying blood to the leg and you start walking, a normal artery will augment the flow. When you exercise, the blood flow increases manifold. But if the main artery is blocked, that blood flow cannot increase.
Okay.
And then we have what we call claudication. Claudication is basically pain on walking. It is named after a Roman emperor, Claudius, who used to limp while walking.
Oh.
And typically when you get severe pain, you start limping a bit.
Yeah.
So that's how the name claudication came. And so this is like a sort of early form of peripheral arterial disease. So either patients may be asymptomatic or mild pain or severe pain on walking. And most of the times we manage these patients with medication. Exercise. Walking exercise is actually, ironically, one of the treatments we prescribe. It's like demand and flow.
Okay.
So the more they walk, the more the leg demands, the more the body generates newer vessels or collaterals to improve the blood flow. But what really concerns us is what we call CLTI or chronic limb threatening ischemia. And this is when the blood flow is reduced so much that the foot is painful at rest. There is an ulcer on the foot which is not healing, or there is a gangrene of the toe. Now these are what we call threatened limbs. They are at risk for major amputation. And these are the ones where we need to do some imaging. We need to do something to augment the blood flow. Now, while we are on the subject of diabetes and PAD, there's one more area of malpractice I would like to point out.
Yes, please.
So diabetics, as we said, they have reduced sensation. Sometimes this reduced sensation is in the form of some tingling, numbness, burning, what we call diabetic neuropathy.
Right.
But the blood flow is good. But then we have some doctors, when they see such patients, they immediately advise a CT angiography.
Okay.
Now, when you see a diabetic patient, as I saw one just before coming here today, he's come from Jamshedpur.
Okay.
He had a CT angiogram, which showed blocks in his arteries below the knee. But his pulses are palpable.
Okay.
Only symptom is some tingling and numbness.
Okay.
Now, these patients are then advised angioplasty or some more expensive procedures. And we've seen such patients in Hyderabad who have normal feet, normal blood flow, undergo angioplasty, which is not required, losing half their foot because of complication of procedure.
Oh.
So, medicine, like any other profession, and doctors like any other profession, they are a subset of the society. So when you are advised an expensive investigation, an expensive procedure, something doesn't click, take another opinion. If it's not an emergency, go for a second, third, fourth opinion till you are satisfied that you are actually on the right track.
Okay, this is very, very informative, doctor. And also the fact that they say vascular health is extremely important because most of the strokes are dependent on it.
Yeah.
Right? So how to, please tell us the preventive measures for it.
So preventive measures for all, now here I would use the term cardiovascular diseases. Because the risk factors for heart disease, the risk factor for peripheral vascular disease, the risk for carotid disease, which causes stroke, they are quite similar. The treatments are also quite similar. We treat with medicines. The medicines that we use, like blood thinning medicines or statins, which reduce cholesterol but also stabilize plaques, they are used in all three diseases. The procedures to augment blood flow, like angioplasty, we use it in all three situations. Bypasses, we use it for the heart, we use it for the legs, we use it for the carotid, so something close to a bypass.
Oh.
Now, these are procedures that we perform on the legs for patients with CLTI. And we actually, in peripheral vascular surgery or PAD, we actually combine open and endovascular at times to perform what we call hybrid surgeries or hybrid revascularization. So it's a combination of open surgery and minimally invasive.
Oh.
But coming to stroke, now stroke happens for multiple reasons. There could be a clot in the heart, could be a clot in the cardiac valve which goes up, and this is typically treated by blood thinning medicines, like patients with atrial fibrillation, patients with mitral valve disease, or patients who have had an MI and a clot forms in the heart. Then the other is clot plaques forming, the cholesterol plaques forming in the major arteries. These are also treated with medication. Now, the cholesterol plaques which form in the neck arteries are what we call the carotid arteries. And plaques which are unstable, that means they are sort of liquid and soft and can break off. These are the ones which result in about 10 to 20% of the strokes that we see in neurology.
Okay.
And these can be treated of, let's say, sometimes there's an early sign, what we call a TIA or transient ischemic attack. So patient gets weakness in the hand or the leg or both, maybe a deviation of the angle of mouth, which recovers in a few minutes. But this is a warning sign. So there is a clot sitting or plaque sitting in the carotid artery, and this we can remove surgically and prevent strokes in future.
Okay.
Now, how do we take care of cardiovascular health? I think this is what every doctor will tell you. exercise is an important part. Our bodies are designed for exercise. Our bodies are designed to be physically active. Our bodies are not designed to sit, not for long. So in fact, there are people who talk unfortunately, legs are made to walk on. The gluteal muscles that we sit on are actually meant to stabilize the hip joint so that we can walk, we can run, we can climb stairs, we can go downstairs, we can go uphill, we can come downhill. Physical activity is very important. And that, I think, is the key to good health. The second one, and the second most important thing for me, is diet. So diet, I advise a lot of my patients because I see quite a few obese patients, and many of them are not at a stage where they need bariatric surgery. But even those who need bariatric surgery, actually quite often they want some other options. So physical activity is one, which increases your metabolic rate and helps you burn whatever calories you eat. Second is reduce your calorie intake and improve the quality of food. So typical dietary advice for my patients is eat 3 meals a day, keep a gap of at least 12 hours between your dinner and breakfast, no snacking between meals, no fruit either, no healthy snacks, because each time you eat something, the insulin levels go up.
Right.
When you eat, take 1 serving on the plate, no buffet style. Buffets are bad for you. You always end up overeating. At least whenever I have had buffets, I have ended up overeating. So I've stopped buffets. I've stopped buffets completely. So 9-inch plate, half the plate should be vegetables. It could be cooked, it could be uncooked. If cooked vegetable curry, use less oil. 1/4 of the plate should be protein, whatever form of protein you like to eat. But again, avoid excessive oil in that. 1/4 of the plate is carbs. That would include your fruits, your rice, and chapati, quinoa, millets, whatever you want to eat. In addition, eat some nuts. The final kicker, don't eat till you start feeling full. Stop before you feel full. So there is a Japanese and Chinese principle of what we call hari hachi bu. That is eating till you are 80% full, and never fill your tummy. Now, you will never know when you're 80% full. You can't look inside and see.
Correct, yes.
So don't ever feel full after a meal.
That is like next time we eat a plate of biryani, stop.
So rather than the biryani versus something else, it is how much you end up eating is actually very important.
पेट भरता है पर दिल नहीं भरता.
तो धीरे धीरे खाना दिल भी भर जाएगा. So what they teach, I have never attended these programs, but some of my friends attended this program of Art of Living. And what they told me was they gave 1 grape, keep it in the mouth, keep peeling it inside with your teeth, bit by bit, savor the sweetness. You can spend 5 minutes eating 1 grape and have that sweetness for 5 minutes, or in that 5 minutes you could eat half a kg of grapes.
Okay.
So the choice is yours. Finally, we come to not only the quantity but quality of food. So while we must eat veggies, a lot of it, proteins, good amount of it, and the remaining carbs, homemade food is the best. Now, why I recommend homemade food is because, one, we look at the quality. Now, if you've been to the kitchen in your house and seen your mom cook?
Yes.
Yeah. So if you are getting any of the leafy vegetables, palak or methi, have you seen how hard it is to clean everything, remove what is rotten, wash it, dry it, and then cook it?
Yes.
How many restaurants do you think will take the pain to do that?
Oh, God.
You see a rotten spot on the tomato, on any veg, you cut it off. How many people working in the kitchens in restaurants will actually take the trouble to do that?
True.
Typically, I would ask, what was it before you actually cooked it? We don't know.
Yeah.
So quality is suspect. Second is the amount of oil that is used, the amount of salt that is used. And it is these 2 things which make the food in restaurants tasty and addictive, including the biryani. And that is why we keep going back again and again for it. It's like Coke.
Correct.
You get addicted to Coke. It's not the caffeine which addicts you, it's the sugar.
Correct.
Sugar is addictive, and that is why we say no sweet sodas for you, for anyone for that matter. They should actually be banned.
They should be banned, clearly, sir. And now we'll move to the next round, doctor. It's called the rapid care round. So, like I said, the answers have to be swift, and they have to be in a word or a line, if you can, please. The first one myth about varicose veins you wish people would stop believing.
Varicose veins are not life-threatening.
Compression stockings, miracle or marketing?
Miracle.
Sitting for long hours or smoking, which is worse for vascular health?
Hard to choose between the two, both are bad.
Okay. Biggest breakthrough in vascular surgery in the last decade?
Endovascular procedures.
Aortic aneurysms, silent threat or loud emergency?
It is silent threat as long as we don't know.
That's a good one. Your go-to tip for healthy circulation?
Walk.
Vascular surgery, art, science or both?
Where science touches man, it turns to art. That is an American poet. I am quoting him.
Satyavachan. Biggest challenge in treating vascular tumors?
The bleeding that occurs with them.
One thing people do daily that silently harms their vascular health?
Sitting for long.
Okay, the next podcast will be me standing or walking or
The next one we should actually do standing up.
jogging, doctor.
I love jogging.
I think that's the only
That
way
is
out now.
one of the things that I really love doing.
I am feeling extremely awful now sitting here for hours and talking to you guys. However, I had a great time talking to you, doctor. Like, I learned so many new things. Like I said, my promise would be to walk and impress you with my walking.
Great.
And the next time I have any doubts with regards to vascular health or people have any doubts, we will come back to you again with a long list of questions.
Yeah, so just to promote this, I am actually registered for the half marathon in August, and I'm going to do that.
I'm going to join you there.
Great.
That'll be my job.
We'll run together.
Yes, doctor. Thank you so much.
Thank
In
you
fact,
very
I'll
much.
carry a water bottle for you there.